Welcome to Living Your Senior Life, the podcast where we explore tips, ideas, and inspiration for making the most of every season of life. Whether it's health, lifestyle, or a little bit of fun, we're here to help you live well, live fully, and live your best senior life. In today's episode, we're looking at senior social isolation, the hidden health crisis. So sit back, relax, and let's discover what we can learn.
Okay, think about this for a second. That feeling of being disconnected, maybe even when you're actually around people. Or perhaps you're worried about, an older parent or relative who just seems withdrawn lately.
That's something a lot of people are noticing, yeah.
Well, it turns out there's this quiet crisis happening. It affects millions of older adults. And it's way more serious than just feeling a bit lonely.
Right.
We're talking about senior social isolation. It's a hidden health crisis, really.
You've absolutely hit on such a critical point there because while, many of us might think, oh, loneliness is just an emotion, the research, it's crystal clear.
Yeah.
This is a profound public health emergency. It has tangible, severe health consequences. So our mission today is really to dive deep into that impact. Yeah. Let's try to understand the root causes, peel back those layers, and maybe most importantly, look at the evidence-based solutions that are honestly within our reach, things that are already working.
And yeah, when we say deep dive, we mean it. We've gone through a lot of recent articles, research, big national surveys from 2020 right up to this year, 2025.
Good data.
Yeah. Insights from the University of Michigan National Poll, the Medicare FAQ National Survey, those big National Academies reports, even the WHO Commission on Social Connection.
Solid sources.
Exactly.
Yep.
So consider this your shortcut to really getting a handle on this really pressing issue. So let's put some numbers on this because, wow, the statistics really show the scale of what we're up against.
They really do.
In 2023, 1 in 3 adults aged 50 to 80, that's 34%, said they felt isolated.
1 in 3, that's huge.
Huge. And even more, maybe 57% of seniors reported feeling lonely in a 2024 survey. But here's the thing that really struck me.
What's that?
Even though isolation levels are kind of back to pre-pandemic levels, that baseline, it was never good. We already had a problem.
That's such a crucial point about the baseline. Because if you connect this to the bigger picture, the pandemic didn't just temporarily spike isolation.
Right.
It fundamentally shifted behaviors, maybe permanently for some. 4 years after lockdowns, studies show 60% of older adults still spend more time at home.
60%.
Wow. Think about that.
Yeah.
Habits formed in that crisis are still here. 75% dine out less, 62% visit museums, theaters, that kind of thing, less than before COVID.
So it's not just a blip. These are lasting changes.
Exactly. They've sort of cemented a new, more solitary normal for a lot of people.
That paints a really concerning picture, this widespread disconnection. Are there particular groups that are hit harder by this? Who's most vulnerable?
Oh, absolutely. The data is pretty clear. Certain groups face a much higher risk. For instance, seniors who are dealing with fair or poor mental health.
Yeah.
Their isolation rates are double those with good mental well-being. It suggests this really strong, maybe cyclical link, mental health and connection.
Right, feeding each other.
Exactly. And also, money matters. Those with household incomes below $60,000 a year, significantly higher risk. So it's often this mix of health and socioeconomic factors creating barriers.
So it's not just about wanting to be alone. There are real, sometimes systemic things pushing people into isolation.
Precisely.
Which brings us to something important. You mentioned the difference between social isolation and loneliness. They sound similar, but they're not the same, are they? And that difference matters for finding solutions.
You're absolutely right to flag that. It's a key distinction. Okay, so social isolation is the objective lack of social connections. It's measurable.
Okay, like how many friends you see, how often.
Exactly. Few relationships, infrequent contact, small network. It's the quantity, you could say. Loneliness, though, that's the subjective feeling of being alone.
Ah, the feeling.
Yes, that distressing emotion. You could be in a crowded room and feel profoundly lonely. Or, you might have someone who's objectively isolated, a content hermit maybe, but they don't feel lonely. They prefer it.
Got it. So isolated but not lonely, or lonely but not isolated.
Right. And both conditions, importantly, pose serious health risks. But understanding one's estate and one's emotion is really essential if we want to find the right ways to help.
That clarity is huge because, thinking about it that way, this stops being just a personal feeling and becomes well, like you said, a public health emergency,
Mm-hmm.
the health effects are being compared to some really serious stuff we all know about. How bad are we talking?
We're talking really serious. The World Health Organization, the WHO, they actually state the mortality impact the risk of dying from isolation and loneliness. It's comparable to smoking.
Smoking, wow.
Yeah. Smoking, obesity, physical inactivity. We're putting social health right up there with diet and exercise in terms of how it affects how long we live.
Okay, give me some specifics.
We're looking at a 50% increased risk of developing dementia.
Okay, percent.
50. A 29% increased risk of coronary heart disease. 32% increased risk of stroke. And get this, for people already dealing with heart failure, loneliness increases their risk of death by nearly 4 times.
4 times. That's staggering.
These aren't small numbers. They're profound impacts on physical health, longevity, quality of life. It tells us our social connections are just as foundational as, say, watching our cholesterol.
That 50% dementia risk, it really reframes social interaction, doesn't it? It's not just nice to have. It's like critical brain protection.
Precisely. And it's not just the physical side. The mental health impact is equally alarming.
Right.
We see much higher rates of depression and anxiety in isolated seniors, a higher suicide risk among older adults, which is incredibly serious, sleep problems, cognitive decline.
So it affects thinking, too.
Absolutely. And it can make existing mental health conditions worse, creating this kind of vicious cycle. Withdrawal leads to worse health, which leads to more withdrawal.
Okay, so the consequences are severe. What's actually causing this? It sounds like a mix of things that have always affected older people, but maybe some newer challenges, too.
That's a good way to put it. When you look at the traditional factors, big life transitions and losses are major players. Retirement, for instance.
Losing those work friends.
Exactly. That daily structure, those connections vanish. The death of a spouse, close friends, that leaves huge, often irreplaceable gaps.
Yeah.
And distance from family is a big one. 1 in 3 seniors say that's a primary reason they feel lonely. Just the reality of families being spread out now.
Mm-hmm.
Then you have physical and health barriers. Chronic illness making it hard to get out. Losing the ability to drive, that's huge for independence.
Absolutely.
Sensory impairments, too, like vision or hearing loss, they can literally double isolation rates because it just makes interacting so much harder. And like we touched on, income below $60,000 limits, options, transportation, activities, even access to services.
So it's this combination of unavoidable life changes and these maybe overlooked systemic issues like health access and income.
Right. A perfect storm, as you said earlier.
But it's not just those classic challenges, is it? You mentioned modern factors. The digital age, which we think connects everyone, can actually be a barrier.
It's a real paradox, isn't it? Technology can connect, but for many older adults, there's this digital divide. Meaning they might lack the skills, or they can't afford the tech, or they don't have reliable internet. So instead of connecting them, it actually shuts them out from parts of modern social life.
Right.
And then, yeah, those lingering post-pandemic behaviors, even after things opened up, many seniors just stayed less engaged. Like those habits of staying home got locked in and are proving really hard to break.
Okay, so it's complex, but the good news you said is we have answers. Research points to ways to reconnect people. So what actually works? What helps people break free?
Yeah, there are several areas with good evidence. First, let's talk community-based stuff. Your traditional senior centers, activity programs, still highly effective.
Like exercise classes, lunches.
Exactly. Group exercise, workshops, meal programs that encourage social dining. That's a big one. Intergenerational programs bringing older and younger people together. Also, faith-based groups, cultural organizations, they offer built-in networks, structure, shared purpose. Very valuable.
That's good to know those established places are still key. But what about reaching people who maybe can't easily get to a senior center? That's where technology comes in.
Precisely. And this is where the role of technology gets really interesting. Things like email, social media, video calls, messaging apps, studies show they can significantly improve self-rated health and cut down loneliness and depressive symptoms.
Okay.
But here's the really crucial part. It's not just handing someone a tablet.
Right. Gotta know how to use it.
Exactly. Successful programs, like one called Talking Tech, they provide the devices, the internet, and this is key one-on-one personal instruction. Hands-on, tailored support that makes all the difference. Virtual senior centers are popping up, even smartphone mindfulness training to reduce daily loneliness.
So access plus training.
That's the formula. Make it accessible, make it usable for the individual. Often that means in-home training.
Makes sense. What else?
Well, healthcare system integration is vital. This raises the question, can doctors and nurses do more?
Yeah.
And the answer is yes. Providers should be routinely screening for loneliness and isolation, especially if a patient has chronic conditions. And then, crucially, connect them to resources, like the local area agency on aging. Make social health part of the checkup.
Treating it like a vital sign, almost.
Kinda, yeah. And finally, don't underestimate the power of purpose. Volunteer and employment opportunities.
Staying active and involved.
Hugely important. We know 44% of seniors work. And often they say socialization is a key reason, not just the paycheck. Meaningful volunteer gigs. Hospitals, schools, animal shelters, food banks, they fight isolation by providing structure, routine, and that consistent connection through shared goals.
Being needed, contributing.
Yeah, exactly. It's fundamental.
That's a really encouraging range of solutions, from community hubs to tech to just having a sense of purpose. So let's make this practical. If you're listening right now and maybe you're feeling isolated or you're worried about someone, a parent, a neighbor, what are the first steps you can actually take?
Okay, for individuals feeling isolated, start small. Don't try to fix everything at once. Maybe think, what kind of connection do I miss most? Is it deep chats, shared hobbies, just seeing a friendly face?
Okay.
Then pick just one new thing to try. Maybe join a club, take a class, volunteer somewhere, focus on shared interests. It's a great way to connect naturally.
Yeah.
And hey, hybrid approaches work too, mixing some online stuff with in-person.
A bit of both.
Yeah. And immediately, you can call your local area agency on aging or check out AARP's Connect to Effect website. They have tons of resources and tools ready to go.
Great practical tips. What about for family and friends who are worried about someone?
Your role is huge. First, watch for those warning signs we talked about. Pulling back from activities they used to love, changes in eating or sleeping, maybe more negativity, seeming down, or their health declining.
Okay, be observant.
Yes. Then, help by making regular scheduled contact. Don't just wait for holidays. A regular weekly call, a quick visit. Include them in family stuff, even small decisions. Help with practical things like rides.
Yeah, transportation can be a big barrier.
Huge. And help with technology. Offer to set up a tablet, show them how to video call. Patient, hands-on help. And connect them to those community resources we mentioned. Even just consistently showing you care makes a massive difference.
It really sounds like consistent, reliable contact is key.
Absolutely. It combats that feeling of being forgotten.
Okay, so as we wrap up this deep dive, it feels like there's momentum. What's next? What's on the horizon in terms of future-proofing connection for seniors? What's exciting?
What was fascinating here is the innovation, especially in tech, focused on connection. We're seeing things like social companion robots being tested, offering interaction, maybe reducing loneliness.
Robots, really?
Yeah, early days, but showing promise. Virtual reality programs creating immersive social experiences, traveling together, visiting museums virtually. Even AI systems for companionship or monitoring well-being are being explored.
Interesting. Beyond tech.
Definitely. Community design is getting more attention. Thinking about how we build our neighborhoods, better sidewalks, good lighting, benches, accessible spaces, simple things that make it easier and safer for seniors to just get out and bump into people.
Yeah.
Reducing those physical barriers.
Making communities more connection-friendly.
Exactly. And then, big picture. Policy and systemic changes are crucial. That WHO Commission on Social Connection. They're working hard to get social connection recognized globally as a public health priority, like clean water or a vaccination.
Yeah.
And there's a real push for integrating social prescribing into healthcare, where doctors can literally prescribe joining a walking group or an art class alongside medication.
A prescription for connection.
Essentially, yeah. Making it a formal part of treatment and prevention.
Yeah.
These are the kind of bigger shifts that could really move the needle long term.
This whole deep dive, it really hammers home that senior social isolation. It's not just the inevitable sad part of getting older, is it?
I don't know.
It's a solvable public health crisis. And frankly, that pre-pandemic level of connection, it wasn't good enough anyway. We have more tools, more understanding now than ever before.
Absolutely. But it takes everyone. It needs individual action, definitely strong family support, those robust community resources we talked about, healthcare getting involved, and really a wider societal commitment to valuing connection.
Every little bit counts.
Every connection made, every program, every person reached it, genuinely makes a difference against this hidden epidemic.
And the research couldn't be clearer, right? This isn't just about feeling happier, though that's important. It's literally about living longer, healthier, more fulfilling lives. So the question for everyone listening is, what steps will you take today? Maybe for yourself, maybe for a senior in your life. Picking up the phone, looking into a local program, offering help with Zoom, even just a regular visit. Every effort matters.
And maybe think about this. What if we truly started treating social connection as a core part of preventative health? Gave the same weight we give to telling people to eat well or exercise.
Yeah.
Imagine the ripple effect. How could one simple, consistent connection change someone's entire world? And what could that collective change mean for public health overall?
It's powerful to consider. Really powerful. Okay, for more resources, remember you can check out AARP Connect to Effect. That's connecttoeffect.org. The National Institute on Aging is nata.aia.gov, health, loneliness, and social isolation. And find your local area agency on aging at eldercare.acl.gov.
Great resources.
And of course, if you or someone you know needs immediate support, especially regarding thoughts of self-harm, please reach out to the 988 Suicide and Crisis Lifeline. They're there 24/7.
Thanks for listening to Living Your Senior Life. Be sure to follow the show so you never miss an episode, and visit livingyourSeniorLife.com for more articles, resources, and inspiration. Until next time, keep living your best life.